We were in the hospital, and the acuity of care, the difficulty of care was quite high. You know, you were always on the go, running, figuring out what was going on, trying to keep people alive. And so that was the primary training in internal medicine. Family practice, I think, was probably the same. But what I discovered when I was out in practice, actually seeing my patients in the outpatient world, was that most, and the data actually support this, most of what I was seeing had to do with lifestyle choices. And the other thing that was very, very fascinating to me, so the data are roughly 80% of all chronic diseases are ameliorated or made worse by lifestyle choices. That's the data. So the other thing that I found really interesting is that I could almost always elicit the right answer if I asked questions about what a person should be doing. And so what I noticed, and my master's in psychology kicked in big time, is that there was a disconnect between the intellect, the knowledge base, and the behavior, action on the ground. Anybody relate to that?
Oh, no.
In my decades of doing practice, I met only one person who really, 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 really insisted that smoking was not bad for him. And there were many varieties of reasons for why they were smoking anyway. And so I got really, really interested in that separation of knowledge and behavior. And that, in a way, has become my area of expertise. And so in the course of looking at that, one of the things that I grew to realize is that it often takes more than talking. It takes more than knowing the right answers. And so I learned to lead people in guided imagery. It's a form of hypnosis, if you will, because what we know is that you can't cognitively think your blood pressure down, for example, or a shift in your heart rate. But you can access a part of your brain that has an effect on the autonomic nervous system. Now, some of you are probably familiar with, we have a sympathetic nervous system, which is under our control. So I think move my hand will move. And we have an autonomic, which is more automatic, which is run by a deeper part of the brain that, thank God, works whether we're thinking about it or not. So our heart will beat and we will breathe. And breath is an example of something that is under the control of both, which makes it a very powerful tool, by the way. Because you can consciously, for example, slow your breath, and that will have an impact on the autonomic nervous system as well, and help to slow the heart rate and lower the blood pressure. So these things that used to be thought of being completely out of our control, although they're not under cognitive left-brained control, can be affected by accessing another part of the brain. And the reason these things are called guided imagery is that it has been found that by working with images, not thinking. So, you know, there are many different parts of the brain, and mathematics, thinking, linear, words, da-da-da-da-da-da. But the imagery part of our brain is a more relaxed part of our brain. People who have been artists, any of you do artwork? Yes. So you probably notice that you get into a different space when you're working. Have you noticed that? And there's a thing called flow, for example. And so we're accessing a different part of our brain, our capacity for thinking, but it's not the way we normally think. And so by accessing that part of our brain, so what is affected by this? The most obvious things are stress-related illnesses. Now, there are a huge number of those. So irritable bowel syndrome, hypertension to some extent, not 100%, but part of what goes into hypertension. Heart disease, part of what goes into heart disease. And also the immune response responds to this. So what does the immune response have to do with? There are, of course, infectious diseases, some of which can overwhelm almost any immune system, but having a more robust immune system reduces the likelihood of infection. So you may have noticed that under stress, it's more likely that you catch a cold. Yes. And so even though weather is not considered to be technically a precursor of the cold, the fact is it has a stress on the body. And so yes, it is, in addition to the fact that we're indoors and around more people. And another very important thing that the immune system does is recognize cells that have gone amok inside of us, cancer. So our own immune system is our first and primary defense against cells that have malfunctioned in some kind of a way. And that's happening all the time. There's a repair network going on inside of us that are taking out cells that have gotten confused about their role in life. And if it doesn't do a good job of that, and a certain mechanism is set up inside of that cell to increase duplication at a rapid rate, that is cancer. That's what cancer is. And so an increased, more robust immune system. So one of the things that got me really fascinated in this, in fact, is Carl Simonton, a physician way back in maybe the 80s, had been doing some very interesting I want to say accidental research, because he has started doing guided imagery to help his cancer patients relax, have less pain, sleep better, the kinds of things you would expect guided imagery, which helps you relax, would do. And he started noticing that the patients who were getting guided imagery were having better outcomes, were living longer than they were expected to live. So I became very fascinated in that and started doing authentic research on that to see the role of guided imagery in reversing or at least reducing the effect of cancer on the human body. Now, I want to give a disclaimer right here, because guided imagery, this kind of work, is not a substitute for authentic medical care. This is about helping the body to do a better job at healing, sleeping, reducing pain, fighting cancer, fighting infection. Third main category, inflammatory diseases. Now, when I started medicine, heart disease was considered secondary to increased cholesterol and blood pressure, and that was kind of the going thing. Since then, it has been found that an inflammatory response is a large portion of the heart pathology that leads to a heart attack. So inflammatory diseases, rheumatoid arthritis, all of the autoimmune diseases that cause inflammatory responses, heart disease, pain to some extent. So I had total knee replacement. Actually, I've had both of them. But the first one, when I went in the hospital, I was scared to death because I used to help with those things. I knew what was in store for me. I knew what was going to go on when my eyes were closed. And I decided to bring one of my own CDs into the hospital with me. And I was shocked. It was very effective. I mean, I was told by the physical therapist that I was up and walking and with reduced pain medicine faster and more than any patient she had ever had in her several-decade career. I might be bragging. I didn't mean to brag. My point was, that the guided imagery really made a difference for me. I was amazed at how it helped reduce the inflammatory response to the pain, and so I guess I'm a testimony to my own treatment. Yeah. Any questions that any of you have right now? Any thoughts, wonderments?
We're curious.
You're curious. Well, I thought what I would do is actually lead you in a very brief guided imagery, very brief, just for relaxation. Is that okay with y'all? No. Dr. Iyer, no. Okay, and I'm going to sit just because it'll make it easier for me to not keel over in the middle of my... All right. And these lights are, is there any halfway mark?
Yep, I'll dim them.
Okay, thank you.
From this side. Tell me where, please. How's that?
That's good. All right, good. All right. So I will invite you, first of all, to uncross your legs and notice anything that is tight or constricting and loosen what you can. And just notice that the chair is supporting you. Really notice that you don't have to work very hard here, that you can let the chair support you. And take a really deep breath in. So it is as if your breathing is going all the way down into your legs. It is as if you can feel your breath going down deeper into the body. And every breath out, you let the cells of your body just relax a little bit more. So that you really are relaxing in the chair and allowing the chair to completely support you. Become aware of the muscles of your face. Notice any tension around your eyes, around your mouth. See if you can allow the breath and relaxation into your face, allowing those muscles just to relax. Feel the nourishment of the breath. Become aware of your shoulders. Any tension, tightness. See if you can drop the shoulders an inch. Allow the muscles of your shoulders to feel as if the breath is coming in, giving you a massage. And roll the shoulders around a little if you want. Deep breath in and out. Just let them relax. Become aware of your hands. Any tension, any fist, accidental, fingers, palms. Allow those muscles to relax. If you need to move your fingers, you can. And then be aware of the muscles along your spine. Just imagine there's a cascading warmth that goes all the way from the nape of your neck down to your tailbone. Warmth penetrating those muscles, letting them relax all the way down into your legs and to your feet. And now imagine that you are in the center of your heart, that there's a room there, and you invite into the center of your chest, your heart, a feeling of great compassion, of kindness, of caring for this precious person that you have been your entire life. No one knows your whole story. You can turn your eyes with compassion toward the course that your life has been. great kindness in the center of your heart. And just make a quiet commitment to yourself to remember that act of kindness in the center of your heart. You can imagine that radiating out into your life, into your future, into what is ahead of you, the choice for kindness. Kind choices. And when you feel ready, I'm going to invite you to wiggle your fingers and toes, roll your shoulders a little. Just be aware of yourself now sitting here in the chair. You can move your body a little, and when you feel ready, you can open your eyes. All right. How was that?
It was delightful. It felt like dancing. It was wonderful.
Oh, that's wonderful. I've never heard that one. Dancing, that's beautiful. Thank you. Yeah, beautiful. All right. So I wanted to share some details about some of these CDs and hand them out. And you can keep them, pass them on, whatever you would like. You might know someone who would benefit even better than you. In fact, if you want to keep one and pass one on, let me know. If I have enough, I'll give you more than one. I would say the Beyond Pain Relief is probably self-explanatory. I hope I have enough of these. I don't have very many of these left. So if you're not struggling with pain, maybe you can pass it on to the next person, or and I want to talk about forgiveness as healing. Actually, maybe I have some more of these. Oh, I do have more. Okay, I think there's enough for everybody.
Okay.
I think there is enough for everybody. All right, the forgiveness is healing. I want to talk about that.
This is the same thing, I think.
Yeah, so far I've only handed out one. And if they're extra, I'll put them back in the box here.
Oh, that's the same thing.
Beyond pain.
He has that, yeah.
Yeah, oh, okay.
Did you want a Beyond Pain Relief? Do you want one? No? Okay. So the reason I did this, I particularly want to talk about forgiveness as healing. I was briefly discussing this with Carrie. A while back, 2 or 3 decades ago, I was asked to give a keynote address to a group of cardiologists on the role of emotion in heart disease. And so I did a literature review to find out what I could on that topic. And to my amazement, I found data that I had never been taught in medical school. So in the 80s, there were a number of studies done looking at the role of beta blockers. Are y'all familiar with that class of medication? Particular class of medication that are used if a person has had a heart attack. And the studies were compelling enough that that became standard of care. So if a person has had an MI, it is standard of care to put them on a beta blocker, and that reduces the inotropy and the chronotropy. So it reduces the heart rate and the strength of the heart. Basically, it helps the heart calm down and not need to work so hard. And so that you know, we just all, if you do internal medicine, if somebody's had a heart attack, they're on a beta blocker. And what I didn't know were those same studies, of which there were quite a few, had other arms, as you would expect. If you know anything about research, there are a lot of things that they tend to look at. And two of the arms that they looked at in particular had a higher chi-square significance than did the beta blocker. Now, I was never taught this, and I understand why, because what do you do with the information? Number one was social isolation, which is why, by the way, people who move into places like this tend to live longer. The data are so compelling about that. So social isolation was associated with worse outcomes after an MI, increased length of stay in the ICU, and the increased likelihood of a second MI after having had a first one. And the second thing that had a very high chi-square significance was what they called it different things, but the name that stuck most with me was the thing they called held-in hostility. And I thought, well, that's interesting. Held-in hostility, very high rates of increased second MI, longer ICU stays, poor outcomes, increased death, and so on. And it just so happened at that time I was on an interfaith council in Oregon looking at a variety of different faiths and their methods and so on and so forth. And it had crossed my mind just shortly, actually, before I was reading these studies, that it was very interesting to me that the one prayer that is in common in all Christian faiths is the Lord's Prayer. Our Father who art in heaven. I thought, now isn't that interesting? So that made me dissect that prayer and say, now what is this? And I was fascinated to notice that the only thing asked of us in the Lord's Prayer is to forgive.
That's right.
Isn't that true?
Yes.
That's right.
Forgive us as we forgive those. And it's automatic, by the way. And I thought, this was like a wake up at 2 a.m. awareness. It's like, my God, that's the answer to held-in hostility. Leading cause of heart disease, leading cause of death. Whoa! So I had been asked to give a talk, so I gave a talk on exactly that, and I was asked to create a CD. So I went into the studio and created a CD on forgiveness as healing. Because the issue, of course, is we can think it. You know that expression, you can bring the horse to water, but you can't make him drink? But when you really get right up to it, this is not, I mean, forgiveness doesn't look like, I forgive you. You know, pretty much not. And so to do real forgiveness is an inside job. Well, that's the realm of these kinds of guided imagery things. It's leading you to the water in the kind of way it makes it a little bit easier to take the sip.